Hello, welcome to session number 1. My name is Katherine Cox, and I'm a horticulture therapy student at Portland Community College, taking the GRN 269 course in Therapeutic Horticulture Skills 1. Today I'm going to be working with my 72-year-old female patient, Phyllis. She's recovering from a hip fracture and is wheelchair bound. And she has limited range of motion in her right upper extremity due to a fall. Our goal is to help her feel comfortable with doing gardening activities in her personal time on her back patio. We are in a rehab setting today. Just to kind of give a brief overview, I am not a registered licensed horticulture therapist. This is just a project for school. We do have some makeshift props to help us with our activity today, which is going to be planting culinary herbs in an ADA accessible setting using ADA accessible tools. Some of the props we don't have, and so we'll be simulating or acting. I did not purchase anything in preparation for this activity, but I planned our session. And also, Phyllis is just acting. She's not really wheelchair bound and doesn't really have these physical limitations. So, Phyllis, thank you so much for joining us today. It's good to see you.
Yeah, me too.
How are you feeling today? What's going on for you?
A little bit tired and frustrated.
Yeah? Are you sleeping well?
Yeah, I sleep okay. It still hurts to sleep on my right side sometimes.
Yeah. What is frustrating for you? What's going on?
I'm just ready to go home and be in my own space.
Yeah, I bet you're looking forward to that. Is there anything in particular that you're worried about as far as going home?
I don't think so. Not right now.
Okay. What are you looking forward to?
Being able to go outside and work on my own garden.
Yeah. I look forward to helping you prepare for that. I think that's going to be really exciting for you.
Yeah.
To start with, I thought we would do a sensory activity. I have some lavender here for you. Here you go.
Thank you.
Yeah. I thought we could take some time to kind of smell the lavender and to learn more about it. And we can just kind of appreciate the plant and look at it. As you smell it, what kinds of feelings come up for you, or are there any memories that you can think of when you smell the lavender?
I just feel calm.
You feel calm?
And reminds me of my own grandmother.
Oh, yeah?
Liked lavender. Grew it herself.
Oh, nice. Did your grandma have a garden?
No, but she liked to grow flowers and just herbs and simple things like that.
Yeah.
Yeah.
I hear that that's kind of what you're wanting to do too. Just a few simple herbs and some flowers.
Something that I can do from my patio and not have to get out of my chair and do too much strenuous work.
Yeah, definitely. Lavender is meant to actually help people feel calm, and sometimes they'll spray it on their, they'll spray lavender spray on their pillow or their bed sheets, and it helps them sleep and helps them relax. Yeah, so
dried lavender is good for that.
Yeah, lavender is great. Yeah. So we can go ahead and set that down.
Okay.
Great, good job. Today I'm really excited about your activity. We're going to be actually planting 3 different herbs. We're going to be planting basil and mint and chives. Have you heard of any of those?
Yes.
Yes?
Yeah, I love basil.
Yeah? What do you know about basil?
It's good on pizza.
It is. That's
Smells
true.
good.
Yeah. It is used in a lot of Italian cuisine, and I know that you really like pesto, and that you've been to Italy before. So
Yeah,
so we're gonna
that's
grow
great.
some basil. And have you ever eaten chives before?
I don't think so.
No?
Well, maybe in a dish, but I don't know for sure.
Okay.
Yeah.
Well, yeah, chives taste a lot like onions, and they're really good for upset stomach. And let's see what else. Oh, and they actually are really good for helping to reduce high blood pressure. That's something I just found out recently.
Well, that's good to know.
Yeah. And also mint is the other thing. Have you had mint before?
I like mint.
Yeah. Mint is also really good for stomach aches, and I know that you are trying not to have caffeine, and mint is a caffeine-free option if you want to make tea.
Oh, yeah.
Yeah. So all of the herbs that we're going to be planting today are culinary, so you can actually use them in your cooking.
That's great.
So they have dual purpose.
I like that.
Yeah. So I'm really excited about that. We'll go ahead and get started. We have 3 different pots, and I'll let you choose which ones you want to put each seed in.
Okay.
I'll let you start by putting the soil in each one.
Okay.
So here we have a little bin of soil,
Okay.
and what I want you to do is I want you to pick up the soil with this shovel, and then I just want you to put it in each pot. Okay?
Am I using my right arm?
I would like you to try and use your right arm as much as possible, and then if it's hurting or if it doesn't feel good, let me know, and we can try and adjust it.
Okay.
If you feel like the tool is too heavy, or if you feel like it might slip out of your arm, let me know, and I can put some foam wrap around it for you and make it a little bit easier for you to hold on to.
Okay.
If it gets to be too much, we can stop and we'll start using your left arm. It's good to practice with both arms.
Okay. Yes,
So.
I'm trying to do.
Yeah.
Well, I think I'm gonna tilt this. So
Okay.
it's a little better.
Yeah. I am here to support you if you need any help.
Thank you.
Yeah.
How much soil should I put in?
We'll say about 2 inches or so.
Okay.
I'll let you know when that's enough.
Okay.
Yeah. You're doing a very good job of holding it. Very good.
Okay.
Very good. Yeah, that looks about enough.
And
Yeah.
This one, I think I'm gonna have to use my left.
Okay.
That's kind of how I try.
Okay. Yeah. You're doing a very good job of using eye-hand coordination. Very good control.
That hurts a little bit to lift it up.
That hurts. Okay.
Yeah.
Let's try using.
I can do about this high.
That high. Okay. Let's try. Let's have you use this tool instead.
Okay.
This is a lighter shovel.
Ah, okay.
Let's see if that works a little
That's
better for
better.
you.
Thank you.
Yeah. Good job. Does that feel a little better?
Yeah.
Good.
Trying to do a little bit at a time.
Yeah. There's no rush. You can take your time.
Is that good?
A little bit more. Let's add 1 more inch.
Ooh, my arm's getting tired now.
Okay, perfect.
Try the
Yeah,
other one.
that's just the right amount. And then we have 1 more to do. And if your arm is too tired, you can switch. Yeah, perfect.
This one I can scoop better because I can lift it.
There you go.
And I need to practice using this one anyways.
Oh yeah, it's important to exercise both arms. So I'm really proud of you. You did 2 pots with the right arm. That's great.
Thank you.
Alright, just 1 more scoop. Perfect. That's great. You can go ahead and set the tool down. So the first one we're going to do is we're going to put the seeds in. I wanted to ask you, would you like to put on gloves?
Sure.
Okay, Perfect. I'll let you go ahead and put on gloves.
Thank you.
Let me know if you need some help. I'm going to put on some gloves too. Also, do you feel like this is a good height for you, this table?
Mm-hmm. Yeah.
So I'm thinking that when we're going on your back patio, it would be great to look into a raised bed for you. So you're able to sit at this level in your wheelchair, and you're able to work with your plants at this level, because it's important that you're comfortable.
Yeah.
Yeah. All right. So first thing I'm going to have you plant is your basil seeds. There you go.
Thanks.
I want you to try using your right hand for this one, and I want you to just pinch one seed, and I want you to just put it in the pot. Yeah. And we're going to kind of press it down in there.
Okay.
Okay? Very good. We're just going to do 3 seeds.
Okay.
Very good. Very good. Nice job. I'll take the rest of your seeds. Good job. Okay. And then go ahead, and I want you to cover that with a little bit more topsoil.
I'll use this.
Yeah, you can use your tool, and you can use your left hand if you need to. Good job. Perfect. So we'll set that one aside for right now. Next, I want you to do this one.
Okay.
We're going to do the chive seeds.
Okay.
And again, I want you to do 3 seeds using your right arm. How's that feeling?
It's a little bit sore, but it's not bad.
Okay. This will be the last time we use it. Perfect. That's good. I'll take those seeds, and you can use your left hand to put in the soil, topsoil. Very good. Nice job. Okay. Perfect. We'll set that aside. And then I want you to do it with this 3rd pot, and here are the mint seeds. And again. Yeah, perfect. Yeah, good job. Good sense of control. And you can use your left hand to put in the topsoil. Good job. All right. So now we have our 3 seed pots, and I'd like you to use this watering can.
Okay.
And I would like you to pour water in each of the 3 pots. Okay? You can use your right hand for support if you need to. Good. Yeah, just take your time. Nice job. Good job.
Is that enough water?
Yeah, that's enough water. That's perfect. One little tip I'll offer you for one gardener to another is that the best time to water is in the morning. If you water at night, the water just sits on top of the soil, and it doesn't fully absorb into the dirt. But if you water in the morning, and you put the herbs in an area where they're getting sun, then the plant just drinks up that water, and it gets to fully utilize it.
Oh, that's good to know.
Yeah, so very good job. I'll let you go ahead, and you can take off your gloves slowly and one at a time. And when you're done, you can give them to me, and I'll put them in the trash. Good job. Perfect. Awesome. Well, you did a really good job with that. I thought it would be a good idea to go ahead and make labels. We'll use these popsicle sticks. 1, 2, 3. And I'm going to let you use my marker, and you can write labels so you can remember which ones are in there.
Oh,
Okay.
Basil.
Perfect.
That was basil, right?
Uh-huh.
Yeah. And this one was, I forget which one this was.
That was the mint. Yeah, I thought it would be good for us to remember so we know what we're growing.
Yeah, I would forget, I think. Until they were really growing.
And then this one is the chives.
Do these all like a lot of water?
They do, yes. And one thing to watch for is that the mint grows like crazy.
Oh, yeah.
When you're ready to move that into it might even need its own raised bed because the
Oh.
mint will just take over.
Yeah.
So we have to really watch that mint. It
Okay.
grows really fast
Keep
and
it
really
in its
easily.
own pot, maybe.
Yeah, you want to keep it separated from the others.
Okay.
Yeah. How was it writing with your right arm?
That was
Your
okay.
right hand.
Yeah,
Yeah.
that part was not bad.
Okay.
Yeah.
Well, it looks like you did a good job with that. Nice job. Yeah, I thought now, so that was our activity. You did a great job. I thought we would do, for your closing, I thought we would talk about your rose and your thorn. Your rose is something that you really liked about the activity, and a thorn is something that was challenging.
Okay. I liked that I got to do something that I like, which is plant stuff, garden.
Mm-hmm.
And I think the thorn would just be kind of trying to scoop with my right arm. Trying to reach it too high, sometimes it gets a little sore.
Gotcha.
But I feel like it's getting a little bit stronger.
It is. You did a lot more activity with your right arm than I was expecting, and that's great. That's really good progress.
Thank you.
On a scale of 1 to 10, 10 being really extremely painful and 1 being not painful at all, how would you rate the level of pain during the activities we were doing today?
When I was using my left hand, it was fine. Sometimes after about the second one on my right, with maybe a 6.
Oh, okay.
Mm-hmm.
One thing I'm noticing, so you said that the pots, the ones that are too high, so we would want some smaller pots for you.
Mm-hmm.
So I will make a note of that. Smaller pots.
Yeah, because lifting is hard
Yeah.
at this height.
Yeah, thank you for telling me that.
Mm-hmm.
Yeah, I thought you did a really good job though, and I'm also curious to know if there are other foods that you would be interested in growing once we get you set up in your back patio.
Oh, I don't know. Whatever that grows well in a pot, I guess.
Yeah.
I'm open to whatever.
Okay.
You seem to know a lot about it, so.
Well, and there's so many different ways that you can grow food now, and you can do raised beds, we could do hydroponic towers, we could do all different kinds of things.
Cool.
Whatever you want to grow, we'll try and find a way to do it.
Okay.
Yeah.
Maybe some tomatoes.
Yes, tomatoes are so fun. I love tomatoes. That's a great idea. Okay, well, thank you so much. I would like to see you at least twice a week as we prepare for you to transition to your home.
Okay.
And then we'll continue to work with your plants, and we'll just continue to work on your right side. And I look forward to seeing more of you in the future.
Thank you. You too.
Thank you. You did a great job.
Thanks.
All right. So I thought I would review our client goals today. I was helping her for physical. I was helping her with her eye-hand coordination, exercise fine motor skills, improve her range of motion, develop the muscles in her right upper extremity, engage in ADA accessible activities without pain. So those were our goals. Physically, cognitively, being able to follow directions and stay on task. I thought that Phyllis did a really good job of that. Socially, having her interact positively with me as the therapist, giving me good eye contact, and also just reducing isolation. A lot of the times when people have a physical disability or they have a fall, and they're not able to do the things that they once loved, they feel a little more socially self-conscious, and they tend to isolate themselves more or not feel as comfortable being interacting with other people. And so these kinds of activities can help her really increase her confidence and find ways to still do things that she loves, just adapting. So that's one thing that I really like about this activity. Psychologically, we are trying to help promote Phyllis's positive emotional well-being and her mood, reduce her anxiety and fear about transitioning. Although she said she didn't have any anxiety, she was looking forward to going home. That might come up later in her sessions as the time gets closer, as she moves to being more independent. She had the ability to make choices and express preferences, find joy in a leisurely activity that has been adapted. And this can also, as the plants are growing and she's growing her own food, she's also getting to raise her self-esteem and promote a sense of accomplishment. And on top of that, she's getting some good nutrition. So, and that can eventually help her make healthier food choices. So that's really exciting. So for my soap notes, I talked about, for her chief complaint, she did say she was tired and she was feeling frustrated. That's pretty understandable given the circumstances. She's ready to go home. I really want to support her goal in wanting to be, getting to go home. And she wants to be able to go outside more, which is huge. Being able to have that fresh air and that connection with nature can be very healing when you have these physical impairments. As the therapist, some things I observed and what she also communicated for her thorn, not being able to lift her right arm very high, having to adjust the tools. She said that the first shovel was too heavy for her, so I gave her a new tool that was a lighter weight. And then she had to switch to her left arm by the time we got to the third pot. And so, although she did very well in using her right arm as much as she could, I did notice that level of weakness. For her assessment, I would say she does need to continue to still develop her right upper extremity and develop those muscles. The thing that's really great about horticulture therapy is that the client is engaged in an activity that's fun for them, and so they're strengthening those muscles without realizing it. They're having fun while they're doing therapy, so that's really going to be good for her. And my plan would be to do this at least twice a week, for at least 15 to 20 minutes for each session, just because she is not at the level where she can do a full 30-minute session. I don't want to push it because she's already rating her pain level at a 6. So I would do it twice a week, but for short spurts of time like we did today. And I would, once she transitioned into her home, I might do once per week, just kind of adjust it to her level, see how she's doing. As far as what worked, I thought that the level activity was appropriate for her level. It's something that she's interested in doing, and it was something that she was able to do successfully. And I thought that as the therapist, I did a good job of adjusting the tools and helping her giving her choices in how she needed to adjust the activity and adapt it to make it work for her level. For something I would change, I would have smaller pots for her because when the pots were too high, she wasn't able to reach. And so I would have smaller pots for her. And also, I almost forgot about the popsicle sticks. I think that it would be appropriate if I had her do the labeling right after she planted the seed, because I almost forgot which seeds we planted them in. And so I think being able to do the popsicle stick label right away after that would have been better. So Phyllis, as the therapist, do you have any feedback for me about how I could have improved your session? Or
I thought it was great, and I like that you explained more about the plants and their benefits, and I like that you just explained everything as we were doing it.
Oh, okay, awesome. Well, thank you so much for being my pretend patient today. You did a great job.
Thanks.
And that concludes our session. So thank you for watching.